ली फेयरक्लॉ हमारे साथ होंगी. And I thank her very much that she did come. Of course, sometimes there are people who lost their loved ones. It can be a mother, father, brother, sister. For example, sometimes I think I wish I would have a better system. I would not have lost somebody who I loved the most. And this is what we are going to talk about. This is my guest is Lee Fairclough is my guest. She is, although she is member of provincial parliament, representing Liberals in Ontario, but along with that she does have वो knowledge उनके पास है. मैंने आपसे कहा कि Fairclough is not only a member of provincial parliament, she knows the healthcare system very well. उसको उन्होंने ऑब्जर्व भी किया हुआ है क्लोजली. फेयरक्लॉ मास्टर डिग्री इन्होंने हेल्थ साइंसेज में हासिल की थी, एमएससी की थी यूनिवर्सिटी ऑफ टोरंटो से. इसके बाद इससे पहले इन्होंने अंडर ग्रेजुएट किया था, वो मैकमास्टर से किया था. सर्टिफाइड मेडिकल रेडिएशन थेरेपी टेक्नोलॉजिस्ट हैं, यूनिवर्सिटी ऑफ वाटरलू से इन्होंने अपनी ट्रेनिंग हासिल की थी. शी इज़ प्रोफेसर भी यूनिवर्सिटी ऑफ टोरंटो में, प्रोफेसर भी नहीं, इंस्टीट्यूट ऑफ हेल्थ पॉलिसी मैनेजमेंट इन एवेल्यूशन में. शी हैज़ सर्व्ड ऑन ओंटारियो लेजिस्लेचर स्टैंडिंग कमेटी ऑन द पब्लिक अकाउंटिंग 29 अप्रैल 2025 से. दिस टर्म शी वन दिस टर्म, एंड ऑफ कोर्स शी इज़ अ वेरी qualified, wonderful people. That is Lee Fairclough. And let me tell you one thing, trust me, I am very honored and proud to introduce here our provincial member provincial parliament, Lee Fairclough. Good afternoon, ma'am. How are you?
I'm doing well. Thank you very much for having me on your show today.
No, honest to God, I understand you are very busy, and I am very much impressed and inspired by your profile that you did your master's degree in health sciences from University of Toronto, which is one of the finest university, and you did your BSc from McMaster University, certified medical radiation therapy technologist bhi aap hain. So this means you must have worked in the hospital, or you must have done some assignments in the hospital, whereas you got training from the University of Waterloo. University of Toronto में साथ मिलके एक प्रोफेसर भी नहीं, Institute of Health Policy Management. Now you know what these hospitals are at the moment, and now the government is making some private hospitals and making healthcare very expensive. What do you think about the future and sustainability of our public health care system here in Ontario?
Well, thank you very much for the question. And you're right. I've worked for over 27 years in healthcare before I became the MPP for Etobicoke Lakeshore. I started on the front lines delivering cancer treatment at Princess Margaret Hospital, and I've been the president of St. Mary's General Hospital and worked at CAMH. So most of my career before I became an MPP was in healthcare. Last week, one of the things that we were talking about here at Queen's Park is that we know that hospitals this year are facing nearly well over $1 billion deficit this year. And, you know, a lot of people wonder, how can that be? But the truth is that our healthcare system and our hospitals are the most efficient in the country. In fact, we spend $1,000 less on average for every stay for somebody in hospital. And we have some of the best performance on measures of quality, like the quality of your surgery, the quality of, that your overall stay in a hospital. And so, for me, it's become very troubling to see deficits accumulating when we know that our frontline workers are working harder than ever to do what they can with what we have available. And so, when I think about the sustainability of our healthcare system, I do believe that a lot of the solutions to the way we can deliver really good care are in our hospitals. I am worried that this government has been consciously underfunding our public hospitals. And you mentioned in your opening, that perhaps they've been giving preference to the more private provision of care. And so, that's where I've got some concerns, and I'm happy to share. Maybe I'll just pause there, and I'm happy to share more on that in a minute.
That's beautiful. Thank you very kindly. Once again, MPP ली फेयरक्लो मेरे साथ हैं. इन्होंने बताया है कि आपने प्रैक्टिस भी करती रही हैं प्रिंसेस मार्गरेट हॉस्पिटल्स में और बहुत सारे हॉस्पिटल्स में, और ज़ाहिर है कैंसर पेशेंट्स की भी देखभाल में इन्होंने अपना रोल प्ले किया. तो मेंबर पार्लियामेंट तो इस साल 2025 में बनी, मगर इससे पहले इनका पूरा का पूरा करियर वाज इन द हेल्थ केयर डिपार्टमेंट. सो शी नोज व्हाट शी इज़ टॉकिंग अबाउट एंड वेयर शी इज़ कमिंग फ्रॉम. You also mentioned that our hospitals are in deficit. Would you mind to tell us what is the cause of this one? I had an email other day and I was surprised to see this. There was a news as well that the hospitals are in deficit. What is the reason for that?
Well, we know that the need for care has continued to increase in Ontario. Like, we know that the population has grown. We know that people continue to age. A larger number are aging, and with that often comes the need for more health care. And so we could anticipate that we would see this increase in need for care. The challenge is that in terms of funding that care, the government, makes choices about where they spend our money. Sometimes they'll decide to spend it more on health care. Sometimes they'll decide to spend it in other areas. The one thing that has me very troubled around their choices is that they've been paying private providers of surgery, for example, 3 times as much as what they would pay a public hospital to deliver the same care. And that's worrying. That's our taxpayer money. In my opinion, I think that we should be paying the same amount with your money for any given care. And if somebody can provide it in equal quality and more efficiently, then that's great. But this is where I get pretty troubled, because if we spend the lowest already in the country on our health care, in terms of what we pay on a per capita basis, per person basis, I'm not sure we can keep pushing our hospitals to become more and more efficient. And at the end of the day, it's our frontline nurses, our doctors, the people that are cleaning the rooms. We continue to reduce what we're spending on food that people need to be nourished, actually, when they're trying to heal. And I think that this government has been quite deliberate about continuing to underfund the system in the way that we need to. So this is what had me last week getting quite concerned. And I drew the parallel between what has happened in education with our schools and our kids' education. I worry that we're seeing the same trend in our hospitals and your care.
Thank you very kindly. Now I understand Doug Wood was saying that municipalities, they put the cameras because they want to generate funds. There's a shortage of funds everywhere. Now, MPP Lee Fairclough, my question here is, what do you expect federal, provincial government to do differently to support the hospitals? Do they have any remedy for that?
Yeah, I think the first thing I would say is that this is all about priority. And healthcare and education, those are the 2 biggest things that a provincial government is responsible for. And so I think making the choice to fund care and fund our hospitals in the way that they need to deliver given there's more and more need for care, to make sure that we fund it to keep pace with it. The second thing is, I traveled around the province this summer. I'm the critic for hospitals, mental health addictions, and homelessness. And so I went into many communities to see the kinds of ways that they're innovating in the delivery of care. And I saw some great examples of that. And we should be scaling some of those examples. A good example was a community-based 24/7 urgent mental health care center, where if somebody was having a mental health crisis, an ambulance could bring them there instead of to the hospital. They would be cared for very quickly and supported in the way that they were needed to. In another hospital, I saw them admitting people to an inpatient unit for their care, but very actively working with people to help them get them home faster and in a safe way by getting them up and moving and really addressing their goals of care. And these are ways that ultimately will shorten the time that people are staying in hospitals and relying on hospitals, which is better for people, but it also reduces overall cost. The other thing I would say is I'd like to see them stop wasting money on things that, again, like why are we paying 3 times as much for the same care in a private setting? Why are we wasting, why are we spending so much, like a $2 billion parking lot at Ontario Place, when actually your first priority should be making sure that we've got health care for people? So this is, to me, this is all about the choices that a government wants to make to support the best care possible.
I thank you very kindly, and I will definitely quote one of your quotation or your words. But you know what? There is a department which after surgery they come to the home. PSW workers who come home and they do bandage and all those. I think there is lot more leakage as well, because they send so much supplies, although pharmacies are making money on that, but the taxpayer is losing on that. You said, these are your words, that you are concerned our hospitals are at risk of the same policies that the Ontario government is using to manage our schools. How do you compare what they are using in the school? They are using same policies in the hospital.
Well, my concern in the schools, and I've got teenage boys that are in the public school system, so I've seen this directly too as a parent. My concern about the schools is that they've, again, been quite deliberately underfunded for the last several years. We now spend $1,500 less per student than we have in the past. And, I think that this is playing out in classrooms with very large class sizes, and also sometimes, seeing concerns around safety for our teachers and our kids. And I think it's been a very deliberate tactic to underfund those systems almost to fail. And this is where I draw the parallel to our hospitals. I feel that we know that 70% of our costs in hospitals are actually to pay for the people that provide the care. The nurses that are there to support, and the PSWs, etc. And we have, we know what it costs. We have labor agreements. And if the government is not willing to fund the full cost of those things, it really sets us up to fail. And people do more and more with less. And again, this is what I feel has happened in education, and this is what I feel has happened in hospitals. And I'm concerned that it really is because there's an interest in more private care and more private education. But I also just see it that these deficits are really a manifestation of a lack of leadership by this government overall.
Thank you very much. Now, my last nasty question is, election just happened this year. So this means to have your plans implemented, we need to wait for 3.5 years more. So by the time, due to lack of funding, and I will die.
Oh. Sorry? Say that again, pardon?
I mean, lack of the funding deficit, and there is no funds in the hospitals. But of course, I know people, very many patients are ignored. They cannot afford few things. So, many people, the Liberals to come back, or we are expecting election in 3.5 years. What will happen in this 3.5 years?
Well, I think here's what I think is important. I think that people care a lot about their health care. And I would encourage people to really speak up about their health care. And the fact that, in Canada, our public health care system is something that we see as so foundational to supporting people in being well and it's supporting people and being able to contribute. And so I would ask people that if they care about their healthcare system to make sure that they're speaking up. Speak up to your local MP and let them know. That's important. The second thing is, and this is having worked with so many people on the front lines for many years, is I have confidence that when you are in need of care, if you're going for surgery in a public hospital, the people that are working there will ensure that the quality of care is there for you. So I don't want people to be worried about that. Like I have a very strong belief in the people that are providing care in our system today. Mm-hmm. What we're talking about with these trends are, if we don't start doing something about making sure that we fund the care that people need fully, with time, that it's going to be even harder to get access to care.
Right.
And I think it's really, that's why I'm speaking up as a member of the Liberal caucus. I think it's important to raise these issues. Maybe that will have the government reconsider priorities that they place on where things are funded. So that's what I would say. I think that if we care about our health care, which I do very much, we have to speak up for it, don't we? And make sure that we protect it.
Exactly. So, no matter who is your member of provincial parliament, could be a conservative, go talk to them and raise your concerns. Thank you, Miss and my respected honourable MPP from Etobicoke, Lakeshore, Lee Fairclough. Thank you very kindly. God bless you.
You are watching eAwas TV, Voice of Community.